Assalamualaikum warahmatullahi wabarakatuh. Good morning, everyone. How are you today? Okay, fine. And then before presentation, I will introduce myself. My name is Muhammad Wahda. You can call me Wahda. NIM 21, 23, 10, 10, 10, 11. Class A 2021. Today, I'm presentation clarifying workforce flexibility from a division of labor perspective, a mixed method study of an emergency department team. Okay, subtopics, background, research question, methods, result, discuss, dan juga, and then conclusion. Backgrounds, many governments are concerned that the current healthcare workforce is not flexible enough to meet increasing and more complex health demands or to achieve efficiency of search results. At the workplace level, the division of labor may be understood from two epistemological positions. First, by measuring the distribution of the organization test between occupational roles within a team. Second, by understanding the social relationship that organize and coordinate the work of this occupation. Functional flexibility refers to an organization ability to deploy the skills of its employers to respond and adapt to change in workload, process, and or technology. Okay, first question, what is the level of labor flexibility of nurses and doctors in terms of division of labor perspective? Methods. An explanatory sequential mixed methods design employed work observations. And then the study site was the AD of a metropolitan tertiary referral hospital in Sydney, Australia. And then there were 146 full-time equivalent or FTE nurse, including for NPS, and 64.5 FTE doctors, of whom 28.5 FTE were junior doctor on rotation through the hospital. Phase 1, work observation, and then phase 2, qualitative interviews. And then results, 1, specialist multi-skilled roles. The time study data show the 3 roles were both occupationally specialized, as indicated by the task categories that consume the highest proportion of their time, and multi-skill undertaking tasks across all categories. And then 2, the flexibility of overlapping roles. There were 2 forms of role overlap within the team. These activities means RNS spent 22.4% of their time on assessment and diagnosis tasks. Registered nurses were also observed to prescribe medication 26 times, 23% of all prescribing, and order investigation on 24 occasions, 23% of the order investigation. And then 3, organizational condition for flexibility. The team's ability to use their overlapping roles to work flexibly rested on the experience of its core, permanent staff, and their deep understanding of ED roles, process, and workload. Interviews noted that those new to the department, especially junior doctors on rotation, did not possess this knowledge. In contrast, experienced ED clinical had a shared understanding of how to respond to workload demands, could anticipate what other team members needed to complete their tasks, and use their overlapping roles to serve tasks when required. Okay, discuss observation of a clinical perspective on the behavior, and organizational context that shape the division of labor revealed that clinicians use their multi-skill overlapping roles to work flexibility, sharing tasks to respond to patient needs, to adapt to changing workload demands consistent with the responsiveness of functional flexibility, unlike the typical characterization of healthcare teams reported in the literature, but typical of other AD teams. The teams understood their roles were interdependent and worked towards a shared goal of timely, quality patient care. Okay, and then conclusion. This study has revealed that the view of the healthcare profession as inflexible. Specialist occupation must be balanced with an understanding of the inherent flexibility of multi-skill nursing and medical roles, and then increasing overlap in the tasks they perform. And then rather, workforce flexibility should be understood as the division of labor, the roles, tasks, and behavior that allows a team to respond and adapt to patients' needs within its organization context. Okay, and then this bibliography. And then any question? Okay, no. Okay, this my presentation. And then thanks you. Thanks. And then wassalamualaikum warahmatullahi wabarakatuh.